Sepsis is a serious medical condition that is caused by body response to an infection. Bacterial infection are the most common cause of sepsis. Sepsis is a medical emergency that is caused by body's response to an infection and can be life-threatening. In that there is inflammation in the body. Inflammation and blood clotting during sepsis causes the reduced blood flow to limbs and vital organs. So, who is at risk of sepsis? The very old person that is older than 65-year-old or very young or pregnant woman. Second one is people with pre-existing infections like diabetes or kidney disease. Third one is people with weakened immune system, that is immunocompromised patient who are in hospital, people with severe injuries such as large burns or wound, patient with catheters or a breathing tube. The causes of sepsis are in abdomen, the infection of the appendix like appendicitis, infection of abdominal cavity like peritonitis, and gallbladder or liver infections. The central nervous system in CNS, infections of the brain of the spinal cord, the lungs, the infections such as pneumonia. In skin is cellulitis, can also cause sepsis. In urinary tract, kidney or bladder, urinary tract infection are especially like if the patient has urinary catheter to drain urine. What are the symptoms of sepsis? That is a fast heart rate, fever or hypothermia, shaking or chills, warm or clammy or sweaty skin, confusion or disorientation or hyperventilation. How to diagnose? We send the CBC. In that we have to find high or low WBC count, low platelet count, acidosis, that is too much acid in the blood culture that is positive for infection, and abnormal kidney or liver function. Then how to treat? The most important concern in sepsis is the quick diagnosis and prompt treatment. The patient diagnosed with severe sepsis are placed in the intensive care unit of the hospital for special treatment. The doctor will first try to identify the source and type of infection, obtain blood and urine test and X-ray or CT scan, and give the patient antibiotic to treat the infection. Intravenous fluid are administered to prevent blood pressure from dropping too low. In some cases, the patient may need vasopressor medications to reach adequate blood pressure. And finally, if organ failure occurs, the patient will receive appropriate supportive care, for example, dialysis of kidney, mechanical ventilation for respiratory failure. So, that's all about the sepsis.